right, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzo.
And I'm Dr. Brad Wiening.
Today, we're going to discuss leg length discrepancy after total hip replacement.
Okay, this is a very important topic, a little bit controversial, and very, very commonly discussed by lay people and on the internet and in little forums.
Sure, it's a touchy subject. It can be a touchy subject.
Yeah. Does this happen, Paul?
Quite often, after you have your hip replaced, the length of your leg changes.
Yes, I would agree with that almost every time. Yes.
Remember, if you have arthritis or AVN or a fracture or for whatever reason you're having your hip replaced, it's shorter than it was years ago.
Yes.
Okay? You're starting out short.
Yep.
Then we replace your hip and
it gets longer. So people are like, well, why? Why is my leg longer? So a couple reasons. So one is that we're trying to restore the normal anatomy that you were born with metal. So like Paul said, you were short before, we give you your normal anatomy back, automatically you're going to be a little bit longer than you were before.
Yes, that we're going back to normal anatomy. Another reason is with hip replacements, one of the complications is dislocation.
Yep.
Where the head pops out of the socket, which is not a good thing. Okay, especially if you're out in public at a restaurant. Whoop, there goes my hip, it's dislocated.
Yes.
You can imagine if we leave that hip short when we replace it, it's going to be a lot looser. The soft tissues will not be as tight and the risk of dislocation will be higher. So surgeons like to get some soft tissue tension, and the way to do that is to lengthen the leg and to put some offset in, to put it away from the pelvis and lengthen it a bit.
And that's what a lot of people don't realize, that when you have a hip replacement, those parts are not all connected to each other holding it in the socket. It's the muscles and the soft tissue tension that does that. So yes, I tell my patients, my main goal is that you leave the operating room with a stable hip. And sometimes that means it's going to be a little bit longer than the other side.
Okay, so you got your leg's long. Is your life over? Is your life ruined?
Well, it depends on how long it is.
Okay.
So there's a lot of different studies, and the number that seems to keep coming back is somewhere in the 1.5 to 2 centimeters or less than 1 inch range is not typically a functional problem.
Right, right. And you got to remember, a lot of people are born and just have one leg longer than the other, right?
Yeah.
A lot of people are walking around, don't even know it.
Yep.
The big thing with the hip replacement is you didn't have it, or you had a discrepancy or a different discrepancy, then overnight or instantly that length changed, so you notice it.
So I tell my patients often they'll definitely feel like it's longer. Whether it actually is longer is very debatable because there are other reasons that the leg can seem long.
Okay, so what can I do? I got one leg, it feels longer, it feels like I'm walking in circles.
Yep. So early on I tell people don't do anything, because sometimes the tilt of your pelvis and your lower back related to your previous arthritis can change your leg length a bit. So often some of that stuff will settle out over the first 3 to 6 months. So initially, don't do anything.
Okay. Wait it out.
Wait it out. What about after that?
So 6 months goes by and you're still feeling awkward with your gait. You feel like your leg lengths aren't comfortable.
Yeah.
Then you can get a shoe lift to put on the other side, on the short side.
Something that like a cobbler puts on the bottom of your shoe.
A big one for the bottom, if it's only like 1/2 centimeter, it can go right inside your shoe.
Like an orthotic.
Yeah.
I tell people early on they can consider getting even an over-the-counter pair of inserts and put both of them in the short leg.
It's a good idea.
Yeah.
See how that goes for you.
I also tell people that probably the only person that's going to know that your leg is short is your tailor.
Right.
And nowadays, who has a tailor?
Everyone buys them online.
Buy them online.
I buy my pants online. So there you go. Leg length discrepancy after. Is it the surgeon's fault? The surgeon make a big mistake?
No, so typically not. Sometimes even during the procedure, you're aware that you require extra length to make that hip stable. Sometimes it's just the nature of your pathology and a combination of your back and your hip and your muscles and a whole bunch of other factors.
Okay, so hip replacement, the side that's getting operated on might end up a little bit longer than it was before the hip replacement.
But it's not the end of the world.
It's not the end of the world. You may notice it, you may not notice it. If you do notice it and it bothers you, you can try putting a shoe lift in the other side. And often, if you have arthritis in one hip, you have arthritis in the other hip. So if I see that in one of my patients, I will have a lower threshold of where to lengthen. I'll lengthen a little bit longer on that side if I know I'm coming back to the other side down the road.
And it'll catch up after.
Catch you up after.
All right, so if you like this video, please like it and follow our channel.
And remember, you are in charge of your own health.
See you next time.